Hi all, we're going to be starting in a few minutes. Welcome to our webinar. Hello everyone. As people are joining, we're going to give it about 1 minute and then we're going to start. So get your coffee and we'll be ready to begin in about 1 minute. Okay, everyone. Hi, my name is Maureen Murphy, and I am a research scientist here at the Global Women's Institute. And I'm so excited that you're joining us for our webinar today. This is a webinar about the Putting Survivors at the Center project. And it really is about supporting survivors of gender-based violence, particularly focusing on the roles of non-specialist GBV organizations. So organizations that don't necessarily consider themselves case managers or really those core GBV response organizations. This is really about a research project that we've been conducting with our wonderful partners, Women for Women International, who are also present here on the call. And we're going to be exploring a little bit about our project that we've conducted over the past 3 years. I will note that we do have a question and answer function established for this webinar. So please, if you do have any questions for the panel, please use the Q&A button. We'll also be recording this webinar and we'll be sharing it through email as well as on our social media channels. So thank you all so much for joining us. Next slide, Gabriella. Thank you. So I first just want to introduce the panel besides myself. So as I said, I'm Maureen Murphy, a research scientist here at Global Women's Institute. I'm joined by Gabriella Nassif, who is a senior research associate with GWI, as well as was the primary project coordinator for the Putting Survivors at the Center project, as well as Katie Allen East, who is the interim director of global grants management and was Women for Women's global manager for this project. We also have Anastasia Olembo, who is the associate director for gender equality and social power at Women for Women International, and she was Women for Women's technical lead for this project. And finally, we have Jeff Habamungu, sorry, Jeff, who is a Women for Women's DRC partnership coordinator and was the main project coordinator for Women for Women for this project in the DRC. So they're going to be joining and contributing to the panel. So let me pass it over to Gabriella, who's going to give us a little bit of a background.
Thanks, Maureen. And thanks everyone for joining us. It's so lovely to be able to kind of tell you all about the work we've been doing for the past 3 years almost. So I'll just start by giving you a really quick overview about what the project is and what our goals were throughout. So putting survivors at the center, which you'll hear us refer to interchangeably as PSC or in its full title, aims to develop new programming models that build the capacity of non-GBV response organizations to receive spontaneous disclosures. So as Maureen just said, and just to really clarify what we mean by non-GBV response organizations, we use this term intentionally to really cover a wide variety of organizations that are operating in humanitarian settings, but that specifically do not provide specialized GBV response. Um, so this can include organizations like our partner Women for Women, who are actually in their own right gender experts, but do not provide specialized GBV response, as well as humanitarian organizations that operate in the non-protection sectors like health and WASH, who of course would come into contact with survivors, but where, who do not have gender or gender mainstreaming as part of their mandate. So that's what we mean when we say these non-GBV response organizations. So PSC is a 3-year project that started with a year of formative research in all 3 of the various contexts where we were working. So this was in South Kivu in the DRC, and we'll hear more about what the project looked like from Jeff later on in the presentation. We also worked in Erbil, which is in Iraqi Kurdistan, as well as in Mosul, which is in federal Iraq, and then finally in Yei and Morobo in South Sudan. And it's really important here to take a minute to stress that in all honesty, putting survivors at the center came out of discussions between us at GWI and Women for Women International. From previous work that we had done together, and also just based on our own experiences and the work that we were doing, it really became clear that there was a bit of a gap for organizations like Women for Women that, again, really wanted to strengthen their own mandate and their own capacity to respond to spontaneous disclosures of gender-based violence, but at the same time, really paying attention to the limits of what was possible for them to do as non-GBV response specialists. And those conversations really drove the mandate of our project. So, and you'll see that in the first box at the top of your screen here. So PSC, what we really tried to do was respond to the direct needs of these non-GBV response specialist organizations. It is a mouthful, sorry, whose staff are not trained in GBV, but who, just by the sheer nature of their work, frequently receive spontaneous disclosures from survivors during their routine programming. And again, this is particularly acute for organizations like Women for Women who carry out really sustained long-term programming with women and girls. And what we learned is, again, not just from Women for Women, but also from the organizations we interviewed during that first year of formative research, is these organizations don't really want to be just passive bystanders. They really want to be better prepared to support survivors following these disclosures. They also want more knowledge about their own roles and responsibilities, and again, how that aligns next to the kind of role of the GBV specialist in the humanitarian landscape. And then finally, organizations were also really interested in how they could empower themselves to support the GBV specialists working in their communities. And we'll hear more about this later in the presentation, but this could look like any array of things. So thinking about maybe targeted support to the GBV specialist that an organization knows and or works with, or even kind of bolstering that to being kind of more substantial support to the GBV cluster or working group. So we had, as you can see on this slide, a lot of partners, and this was really one of the kind of brilliant strengths of putting survivors at the center. So, and this starts with Women for Women. So Women for Women, for those of you who don't know, they operate globally and in a wide array of countries. So this really gave putting survivors at the center an awesome opportunity to build different types of activities and to pilot them in really different contexts. So at the global level, of course, and you'll hear more from Katie and Anastasia. We had our global teams at GWI and Women for Women, and then we also had country level teams with Women for Women. So in the DRC, in Iraq, and Kurdistan, and then South Sudan. And then what we did was in each of these countries, with Women for Women kind of really leading the charge here, with support from us at GWI, we hand selected a couple of local partners in also working in non-protection sectors to again work with us to pilot a variety of activities to kind of build this capacity to support survivors. So at the very bottom of your screen, you'll just get a kind of sample of some of the sectors where these organizations worked. So we had organizations that represented WASH, nutrition, health, PSS, and education. So that was just a quick little overview, and now I will pass it on to Katie, who will walk you through a bit more of the details about, where we went from that first bit of formative research and how we arrived at our pilots. So Katie, over to you.
Great, thank you. Yeah, so the project's been split into 3 phases. The first year pretty much was the formative research phase, which I'll talk more about in a second. Then the second year we had about a 12-month period where we were actually piloting a suite of activities, which we'll also talk more about. And then the final phase has been the consolidation of learnings and disseminating findings, which is what we're kind of doing right now. So the formative research included a global literature review and then a lot of participatory action research. So we consulted directly with survivors, with other stakeholders in country, and we held in-country workshops and then validation workshops in each of the 3 countries. And we were really looking in all of that research to understand what were the barriers and challenges preventing survivors from accessing specialized services, and then what were their recommendations to overcome them. And we used all that information as the basis of designing the pilot activities. And then that helped us formulate 3 key thematic areas that we focused on for the pilots. The first was around the improved immediate handling of GBV disclosures and safe referrals. So really helping those frontline people that are hearing the disclosures, what can they do immediately? Then the second pillar was around connecting to and supporting existing specialist services. So how can, as non-specialists, we make sure that we do those referrals and that we're working more closely with the specialists? And then the third pillar was looking at ways, kind of informal ways of supporting the psychosocial resilience of women and girls and survivors. So I'll just share a little bit more of each of the 3 pillars in terms of kind of what were the key activities that we've done under each of these. So under the first pillar around handling those immediate disclosures, the real kind of landmark piece of this, I suppose, or the core piece of this was a training, handling disclosures and safe referrals training that was developed. And this was a 3-day training for frontline staff with an extra half day for kind of managers or organization leaders. And then we also developed a day-long refresher training that can be done 6 to 12 months later. And that really looked at psychosocial first aid, the linking, the referring survivors onto services, has a big focus on confidentiality and data protection. And it also looked at helping people better understand what are the roles of GBV specialists and non-specialists, and where are the kind of boundaries or the lines between what we should and shouldn't do. It was very practical. It included lots of role plays and scenarios, and ways for people to really bring to life what this can look like and start practicing kind of, receiving the referrals in a survivor-centered way. And it was also, there were various adaptations of this. So we have a separate version specifically for community leaders. And we've used that for a range of different types of community leaders. It could be traditional religious leaders, could be women leaders. We've done with secondary school teachers in the DRC, and social workers, for example. And we've had really positive feedback overall on this training. We did pre-post tests. We did then kind of reflection workshops with people that participated in it. And we found that it has really helped to reduce bad practices that were happening. Things like people trying to mediate in intimate partner violence situations or breaches of confidentiality that a lot of people didn't even realize they were really doing. So it's really helped to kind of limit those bad practices, and it's also helped improve understanding of survivor-centered principles and build confidence in dealing with these situations. Under the second pillar, the connecting to support specialist services, this was quite a broad range of activities. I'll actually go to the last point first. So building a bit on the training, we did do some kind of related training for people that are part of the referral pathway. So police, security forces and social workers in South Sudan. That's what the picture is showing there, the training that they did. And we also developed a specific training in DRC for health workers that was based off the research that we did there that wanted us to train them on kind of gender equitable attitudes, confidentiality and data protection, and survivor-centered approach. So it looked more at those issues. Obviously, they're already kind of technically experts in how to kind of, you know, medically support GBV survivors, but we were looking more at those soft skills. And then we did a lot of facilitation of bringing together specialists and non-specialists. So we organized facilitated dialogues, and this really helped to increase understanding and trust between those two kind of groups of actors. And that led to increase in referrals because the non-specialists felt more confident in being able to refer. And we also did a few things to just break down very practical barriers. So we piloted an emergency fund that would help cover those limiting costs that some survivors were facing to either get transport to a service or to pay for a service. We worked with the UNFPA in Iraq to on a new referral app that they were developing, and we brought in that perspective of the non-specialists and then helped to kind of roll it out and train non-specialists on using that. Yeah, and then finally under the third pillar, so this one looked at a range of different kind of informal psychosocial support activities. So one that worked really well was group kind of self-care sessions that used very practical tools, like, you know, got women doing like planting flowers or colouring and doing activities, therapeutic activities, but also then talked about practical self-care tips, stress management techniques, support networks they could call on, and that helped to increase the number of referrals and got very positive feedback. Lots of women asking for more of those sessions and for more people to be involved in those. We also did a self-care training for frontline staff to try and similarly give them some of the tips, because they're obviously dealing with stressful situations on a daily basis. And we offered some one-to-one drop-in sessions, but those were only for women who had declined to actually have a referral to specialist support, and then we would offer them some very kind of light touch, again, support on stress management techniques, self-care techniques. So yeah, that's a quick big picture overview, and now I'll hand over to my colleague Jeff to share more details from the DRC.
Jeff, you're muted. Can you unmute?
Thank you. I meant that in the DRC, the overview of the activities that we did, the key program activities were incorporated in the 3 thematic areas that Katie has just mentioned. In the first thematic area, improved immediate handling of GBV disclosures, we conducted a training for frontline staff, for community leaders and other stakeholders like police. We also trained the psychosocial assistants. We also trained the school teachers on appropriately handling GBV disclosures. All these people came from different small community groups, and then they attended the training that they liked so much. And in the second thematic area, which was connecting to and supporting existing specialist services, we tried to do what we call strengthening survivor-centered approach and the gender equitable attitudes among health centers with the who came from the 7 health centers that with which we had partnerships for referrals of GBV survivors. We also strengthened the coordination between GBV response specialists and non-specialists via exchange dialogues, which strengthened trust and collaboration between the two groups, and it helped them be aware of their roles in their respective areas of work. We also strengthened the referrals pathways by supporting survivors through the emergency fund. This emergency fund was put in place by the project, but in partnerships with the health centers that we worked with. And through this emergency funds, we supported survivors through by getting to psychosocial support and medical support in the health centers. And where they could not do the proper support, they could also refer to other specialists according to the needs of survivors. We also did some raising awareness sessions, including the male champions. Through the project, we designed a program to men who followed the training of a men engagement program and who now have become advocates for women's rights through this program. For the third component, we also supported survivors through psychosocial resilience. We provided informal psychosocial support. We also trained the frontline staff on self-care so that they could be aware of how to behave in order to be able to support survivors as well, because they also needed some self-care training to cope with all the work that they do every day in terms of supporting GBV survivors. In DRC, we had some key learnings. The first learning that we had was that handling GBV disclosures training, it helped frontlines reduce risk practices and effectively apply survivor-centered approach principles, which is based on the 4 principles: respect, safety, confidentiality, and non-discrimination. We learned that this training was very important for these frontliners because it helped them internalize these principles and base their support on best practices on the interest of the survivor. We also learned that frontline staff felt more confident using a psychosocial first aid, which is linked with the 4 steps in handling GBV disclosures and making safe referrals. And they were now able to prepare the environment, to look at the survivor, to listen to the survivor, and link the survivor to special services whenever there was a need of such services expressed by the survivor. We also learned that training on handling GBV disclosure increased empathy and active listening among teachers of secondary schools, among community leaders, and it led more disclosures in schools as teachers became trust confidence. Through this handling GBV disclosures, we had more disclosures which were immediate, which came from survivors from the different areas where the training was held. We also learned that exchange dialogues between GBV and non-GBV specialists built trust and strengthened the knowledge and use of referral pathways and made them aware of the limits in their respective roles. Because before there was some lack of confusion. Those who are specialists had some confusion and they could not know what are their limits, and then the project has brought in a bridge, a collaboration between the 2 categories of people, and now it is on the benefit of survivors, and especially that they know all the pathways to referrals which are existent in each community. We also learned that health workers showed improvements in knowledge and attitudes towards supporting survivors, including listening, empathy, and confidentiality, especially in terms of data protection. This was mentioned when we were gathering their learnings. They said that this training on gender equitable attitudes helped them a lot to know how to stay confidential with the stories of survivors and protect data. We also learned that emergency cash helped many survivors to overcome barriers to accessing services, but not necessarily sustainable, unfortunately, because they are based on projects. But the people who received the survivors, they testified that this cash was very important because women could easily access to medical and psychosocial support without a fear that they will be charged anything. Then I would mention why we found this project important, especially in the DRC. This project raised the awareness of GBV, which remained widespread and underreported, especially in schools and rural areas, because many survivors are not open to say that they have been experiencing violence. But with this raising awareness sessions, they are now open. They are trying to say, I've been victim of violence, and they are ready to seek support. The project also helped a lot in putting in place safe places, confidential spaces to disclose experiences. This is the case, for example, with the safe spaces that our local partner Rio put in place. There were 15 safe spaces through which people could come in the area of Kabare, in the area of Kalehe, in the area of Plaine de la Ruzizi, that is in Uvira territory. And the women and the girls were very confident. They were very calm. They know that here, this is a place where I can easily talk, I can freely talk, because I trust the people who are going to welcome me, and I trust the people who are going to help me, and I trust the services that are going to help me, because my stories are going to be kept confidential, and this created safe spaces for these survivors. And then the project equipped teachers and leaders with knowledge and tools, as these are first responders without adequate tools. The tools that I'm mentioning here are tools like referral forms, consent forms for survivors, that survivors have to consent before they can access any services. They have to give their consent. They feel they are not being forced, but they are going there because they trust the people who are going to help them and the services they are going to access. And the project bridged this gap between the people who receive disclosures and the people who are supposed to help survivors. So through safe referrals, then there is a limit of responsibility. The people who receive disclosures know that this is our limit, and this is what we cannot do. And the next step is to link these people who need help to the people who are specialized in such and such area. The project strengthened trust in Women for Women and local partners like Rio. So before, the Women for Women was not really working with the local partners, but through this project, Women for Women has got the opportunity to collaborate, to work directly with the local partner. And if this one-year pilot strengthened this collaboration, and Women for Women is now trusted on the ground. The project helped shift harmful norms, and it improved survivors' access to services. Because, these harmful norms are deeply rooted in the society. And this project, when training community leaders who are cross-keepers of these harmful norms, they learned that they are to support women, they are to go beyond these social norms, and they are to advocate for gender equality and help survivors to access services. This is, in brief, what we had in the DRC. To pass the floor to
me. Thank you, Jeff.
Gabriela. Thank you.
No, thank you. it's, as you can see, we did quite a lot, and that, Jeff was a superstar and managing all of this, and that was just one of the 3 country sites, right? So we still had work that we were doing in a wide variety of activities also in Iraq, and in South Sudan. So I just want to take a few quick minutes here to kind of recenter us after looking at the DRC's activities in particular. And then I'll pass it on to Maureen to talk about some of the key learning products that we developed based on all of these learnings that Jeff just highlighted for us. So again, as you just heard, that was only one example of the activities that we ran in one of the countries. So there were 3 countries in total, which means, there were a lot of different activities. So we talk about PSC as offering what we're calling a suite of activities. And really, I'm actually going to start at the very last bullet point. The thread that ties all of this together is that at its core, PSC believes that supporting survivors is everyone's responsibility. So it is no longer an acceptable sort of excuse to say that, I'm not a GBV response specialist, or I don't have an understanding of kind of gender mainstreaming or gender work, so to speak, right? We really built this kind of suite of products around this notion that it's everybody's responsibility, and there are things that you can do, again, along a spectrum, starting from at the top in that green box, things that are more foundational, like both Katie and Jeff talked about, which would be our kind of core training, which is really prepping frontline staff at your organization to just be prepared to do PFA, so psychosocial first aid, and to really respond using the survivor-centered practices and guidelines that are recommended. And then moving on, if your organization has maybe a deeper capacity or a deeper commitment to doing a bit more, we have also built out a set of activities. Again, Jeff mentioned a few that look at facilitating referrals. So we really see non-GBV response specialists as a kind of core ally for GBV specialists, and really for the kind of wider landscape of the protection sector, to really help get survivors, at least to get the information about the specialized response services to them, and then with the ultimate goal being to get them into the referral pathway. So we've developed a wide set of activities that really try to strengthen and facilitate these referrals. And then finally, kind of at the higher end of the spectrum, so to speak, are a set of activities that we've developed for organizations that have a close relationship with their GBV cluster or working group, and really would like to think more creatively about how they can support and empower the cluster. And again, we really see putting survivors at the center as fitting in with all of the other guidelines that exist. Again, across another spectrum, ranging from something that is, a little bit more basic and getting folks to understand what and how you should respond when you receive a disclosure from a survivor, all the way to the, specialized response end. So we see ourselves kind of working as a bridge, right? So between this more minimal support to the kind of expertise that exists at the end of the spectrum with the GBV specialist. And we're kind of, we see ourselves as a bridge and situated in that middle pink box, right? We're looking really at these organizations, again, like Women for Women, that have sustained long-term engagement with women and girls in their communities, and have the capacity and really a desire to kind of strengthen their ability to support survivors. And just to reiterate what Katie mentioned earlier on in the presentation, we've really focused these sets of activities around these 3 core thematic areas. So improving the immediate handling of a spontaneous disclosure of GBV, strengthening and facilitating referrals, and then finally supporting psychosocial resilience. So now I'm going to pass it on to Maureen, who will talk about some of the learning products that we've actually developed based on all of our findings. Over to you.
Thanks, Gabriella. So we've had 3 years of work, and so we've now been able to try to consolidate our learnings, and we're really excited to be able to share them and have them available for other organizations that want to do this type of work. and want to build out on our approaches. So we have basically a package. Obviously, there's a lot of activities under this project. As you've heard from all of the previous presenters, it is a lot of moving parts. So we really are trying to simplify it for anyone that wants to take up this work. And we have our overall guidance document, which is kind of the core of our materials. And I'll give you a little bit more detail about that. But we also then have some more deep dives in case studies that take different parts of our approaches in a little more detail. We have actual program materials. So if you want to do our trainings, all of those materials are available for your use and adaptation. And then finally, we've also tried to package our materials for the use of our sector colleagues, because really the focus of this project isn't necessarily for GBV specialists. It is for organizations that focus on other types of work, right? That people that are working with women and girls through nutrition programs or through water sanitation programs or economic empowerment programs. So we really did try to create some materials that hopefully can speak specifically to those groups. So first off, the overall guidance document, as I said, is in that purple box. It is the center of everything. If you only look at one document, definitely the one to look at. And we'll, at the end of the presentation, there'll be a link to our materials on our website, and we'll also try to put it in the chat so that you can take a look. But this is the document that's linked directly on our website, because it really is the summary. And it's going to take you through kind of how we did this work, what it involved, the three thematic areas overall, and it's really just the best place to start to learn more about our approach. Next slide. We will go through each of the three thematic areas. So just as Jeff presented, the project is divided in these three thematic areas. The first, the improving handlings of disclosure. The second, connecting survivors to specialist support materials. And the third being supporting psychosocial resilience. So the whole manual and all of the support materials are all under those three guidance thematic areas, which will again, hopefully help you navigate where you want to go. If you don't want to necessarily read the whole document from start to finish, you're just really interested in psychosocial support, you can skip right down to that third pillar, and that will be your place to learn all about that and our approaches. Next slide. Oop. Sorry, can you go back, Gabrielle? Yeah. And then finally, we also really did try to, again, make it easy for you. So if you're in our overall guidance document, at the end of each of the thematic areas, you will see that we do have the support materials all linked. So again, if you don't want to have to fumble around on our website and try to find, the training materials for the Handling Disclosures Guide, you can go to our overall manual, you can go to that section, and you can just click straight on it, and it will take you to a box link that will have all of our training materials, handouts, pre and post tests, all the materials that you need to be able to actually implement that activity that we have publicly available. Ideally, eventually, we will have them available in other languages. Right now, one of the unfortunate constraints of our project is they are only available in English. This was originally funded by USAID, and I'm sure everyone here knows there have been some challenges in USAID funding in the recent term. So unfortunately, the planned translation was not able to go forth, but at least we're able to release these materials in English, and we're hopeful that in the future we can still have translated materials. Next slide. Moving into the case studies. So the case studies themselves, they are really just deeper dives. Say you want to use the Handling Disclosures training. You are interested to understand more about some of the details of the training. You kind of want to get some experiences from others. How did it work in the DRC? How did it work in South Sudan? How did it work in Iraq? What are some of the lessons that we learned? That is all in these case studies, as well as a lot of our data that we used or we collected through the piloting process that sort of shows, what the learnings were, what the changes were, what the outcomes were for our participants, et cetera. So for example, maybe you want to try to get this a component of this project funded through a donor, looking at the case studies is a great place to look because it will actually give you some of the data that we were able to generate about these areas. And we did 5 case studies. So these are just, there are other activities under the project, but these were kind of, we felt, the 5 of the most prominent things that came out of our learning and things that we felt like really deserved a little bit of additional thought and exploration. So we have one for just the handling disclosures training and support package. We have one for working with community leaders. So again, it's a similar package to the handling GBV disclosures, but it's really more focused on specifically community leaders who obviously don't have the same technical skills or professional mandate, perhaps, as you would get for staff or volunteers. We have one on improving coordination between GBV and non-GBV specialists. I mean, this is something that obviously we found throughout our entire project was so essential, because really one of the learnings and what, as the project evolved, one of the things that really came out was the need to build trust and understanding between these groups. Because what we generally find is that non-specialists just would give a cold referral, say go. That person might have a bad experience for whatever reason, maybe never go because they don't have the financial means, maybe get there and be turned away because they don't have the right information or forms. There were a lot of breakdowns in that referral. And one of the real hopes of this project is to move non-specialist organizations away from just saying, oh, well, I tried and it didn't work. Rather than just saying that, one of the goals is to say, oh, I tried, this person had a bad experience. How can we support this? How can we support specialist organizations? How can we support the survivor to make this a better experience, to make it more of an active role for non-specialist organizations, that they should really try to work and strengthen GBV support services and strengthen that referral point to make sure that survivors are able to access this. And when they're not able to access specialist services for whatever reason, also just making sure that we can do what we can by promoting psychosocial resilience. So this is, as Katie mentioned, not case management. It is not going forth and doing, that detailed one-on-one support that you would get with a specialist. It really is just a way to support women and girls in general who may or may not be survivors, to help build up their self-confidence, their self-esteem, their resilience, with the goal that they will eventually be able to access those specialist services. But for a lot of survivors, they're in that middle point, they're not ready yet. And so we want to kind of meet them where they're at. And the case study on psychosocial resilience really does try to support that. Next slide. And then finally, we have these sector briefs, which are really, they're very brief, they're very short. I think they're at most 2 pages, maybe 3, but very short, lots of tables, lots of graphics, not a big read, but these are really to help identify entry points for our colleagues working in these sectors. So if you are working in the health sector and you're interested in better supporting survivors, here are some of the entry points. Here are some of the materials and tools that you can use that are relevant for you. And really just tries to be, clear and quick, and are meant to share information to these different stakeholders. So we developed them for the health sector, water sanitation, education, MHPSS, and nutrition. So they're all there in the materials and are really just a repackaged way of looking at some of our information for these different groups. Yeah. And then finally, of course, we have all the support materials that also still exist. And again, these are the training packages, the handouts, the pre and post tests. Some of them are listed here. There are others as well. They're all available. When you actually look on our website, you'll see we have the main guidance document on the website, and then there is going to be a box link below it, which will have, for example, all of the case studies, the sector briefs, as well as the program support materials. And again, these are totally adaptable. Please feel free. We really do try to say that these were piloted and developed for a global setting, but likely you're going to need to contextualize. We try wherever possible to put little globes, which are points for you to know this is something that should be contextualized. And so, yeah, that's all available for your use. And you can see, here's the link. You also see it in the chat box as well. You would see that little report, there's a link there for the main guidance document, and the little blue, or not blue, it's green, sorry, apparently I'm colorblind, the green box below, that is the link where you can find all the support materials that will allow you to do a deeper dive into this. So yeah, with that, I want to say thank you. I'm going to be passing it over to Katie, who's going to facilitate a little bit of a Q&A. But really just to say that this does take a village, this whole project. As you can see, we have multiple partners. A number of them are here on this webinar, and we're so happy that you were able to join. You know, I see wonderful people from our Iraq team, from our DRC team. I see some of our consultants who have helped develop this work. And truly, you know, we couldn't have done this project without you. So it's with our heartfelt, you know, thanks to all of you. And we're so excited that all these materials are now finally available for others to use. So with that, I'm going to pass it on to Katie.
Great. Okay, thank you. Well, to kick us off with the questions, I'd love to bring in Anastasia at this point. Could you tell us, from a global perspective, what did you learn from the PSC project, and why do you think organizations similar to Women for Women take up these approaches?
Thank you so much, Katie. This is really a very interesting question and important. What we learned from this project, one, relationship building. As I was sitting here listening to some of the examples, I also realized there is so much non-GBV specialists would do with the resources and knowledge, understanding from this project. The project basically using research, participatory method, and collaboration with partners. We learned that that's a very good practice, because then there is that creation of ownership. And from a global perspective, we provide technical capability and also ensure that quality and timely implementation of the project takes place. And so when it comes to now supporting the teams on the ground, in terms of relationship building, in terms of ensuring that what we are supposed to be, the outcomes are expected are realized. This, of course, meant that there has to be that collaboration, but also relationship building. The third thing is about partnership. At the country office level, but also at the global level, we realize that there are many organizations that are like Women for Women International. They work on women and girls empowerment, gender equality, transformation, but they receive disclosures, but they do not understand how something can happen to a survivor between where they have come to report and where they can get access to services. So understanding the survivor-centered approach and ensuring that this is followed all the way to the case management becomes very, very important. So at the global level as well, we realize that this is one of the areas that we needed to support so much, so that we build relationships with also the service providers, and we know where they are, both at the global level, but also linking them at the community and at the country office level. So why it is very important that other organizations like Women for Women should actually use the approaches that we have used is because we have seen results. We've seen capacity developed, and that capacity was able to help to ensure that a survivor can report, can disclose, and they can be taken care of within their immediate needs can be met while they are getting information and being referred to services that have already been mapped out and relationships have been realized. The second thing is, of course, because without training, without resources or materials that have been tested and approaches that have shown positivity, it becomes very difficult. So looking at this survivor-centered approach and the resources that we are already now talking about, that we have been able to develop case studies, materials for training that are already made. So it will definitely help non-GBV specialist organizations that are operating within the humanitarian spaces to be able to utilize these materials and provide leadership, but also ensure that, because the space about funding is actually becoming very tricky, especially when we are addressing issues of gender-based violence or anything gender-related. So it becomes very, very important that we can utilize already resources that are developed, but we should also be able to go further and develop relationships with the case managers, the specialists who are in the field. As we have seen, they also require their capacities to be developed in terms of the attitude, the how they handle the survivors when they are referred to them. Sometimes learning from our experience, we realize in some of the context, the service providers, some of them did not have the capacity to deliver some of the services that are supposed to be delivered. And so just mapping those service providers and having real-time data and information that can help safeguard the survivor. And so I would want to encourage other organizations like Women for Women to be able to go forth and ensure that you can utilize these materials, and where you feel you need further information, you can always reach out to Women for Women International Global Women Institute, and of course in their website where they have already launched the materials. Thank you.
Great, thank you so much. Okay, now there's a couple for Jeff. Firstly, we have some feedback or a comment from one of our colleagues from Rio in the chat. So Jeff, it would be great if you could maybe share that. And then a question for you as well. How can country offices of non-specialist organizations like ours, how can they institutionalize supporting survivors? What practical steps do you think they should take to support survivors?
Thank you for the floor, Katie. I'm going first of all to the intervention from the male officer from Rio, who says that in addition to what I mentioned as the importance of the project, he says that the kind of response that we brought to the survivors of GBV was like an exception according to them, because it was based on the local realities and contexts. It was we listened to the survivors, we put them on the center, and we brought some other important aspect on the mentors of the safe spaces who were able to learn about how to connect survivors to specialist services in the organization. And they learned a lot about confidentiality. This came up throughout all the project implementation, in the workshops of gathering learnings, when we're collecting learnings from stakeholders. This was really very mentioned every time, confidentiality. So throughout, thanks to this project, Rio learned a lot about confidentiality. And as to what, from a country perspective, what the offices of non-GBV specialists can do in institutionalized supporting survivors is that, first of all, non-GBV specialist organizations do not need to be specialists to support survivors. What they need is, first of all, to recognize that their responsibilities. They need to have partnerships through local organizations which can do the job that they cannot do. They need to have policies. As for the steps that they can follow to support survivors using these models, first of all, they have to integrate self-disclosure and referral protocols in their standard operations procedures, in their programming that they do every day, like education, like wash, like nutrition, like health, like mental health and psychosocial support. What they need is just to include in their standard operation procedures things how to handle immediate disclosures and how to make safe referrals. What else they have to do? They have to ensure there is regular training and for frontline staff on handling GBV disclosures. And another step, which could be the third step, they need to make sure there is always a regular mapping of services, of GBV specialist services, which can support the survivors in case there is a need of referring. They also need to design focal points for GBV safe referrals in each community where they are working. Those focal points should be the people who followed this training on the GBV, on handling GBV disclosures, so that they can be able to practice all the principles related to governing this survivor-centered approach. They also need to do some mechanisms that protect the survivor in the way that the confidentiality is not broken, and they ensure that safety of survivors is guaranteed through all the principles and all the steps that they have to go through in providing PFA. Thank you so much.
Great, thank you, Jeff. Okay, I think we've got time for maybe one more question. There's one about can the materials be adapted to the specific non-GBV specialists being trained? So this person's curious about how different the trainees were in the different countries and if they were engaged differently. And then also just kind of building on that, I'm going to ask Maureen this question. How can we, given the kind of changing global context for humanitarian funding, how can we really utilize these approaches to support survivors now?
Yeah, absolutely. And I think actually probably these questions are quite linked in that we absolutely, basically, we kind of created a core module, which is the handling GBV disclosures module, but then that was really like the launching point for adaptations. The biggest adaptation that we did was the specific one for community leaders, which obviously takes some of the longer, more technical stuff and shortens it, makes it simpler for low literacy contexts, etc. But we also, for example, did a lot of adaptations for groups like, say, teachers. In both the DRC and Iraq, teachers and schools were big areas where we did piloting, and obviously a lot of that material needed to be changed and adapted for those groups, because particularly because we're talking about underage populations, but we're also necessarily sometimes seeing teachers or sometimes social workers or counselors who are based in schools might be coming at this work with a different skill set. So absolutely, I think an adaptation process, depending on what your group is important, because everyone's going to come at this with slightly different knowledge, slightly different skill sets. And it's also important to remember that we're trying to integrate into the local referral pathways. So how you refer a student who discloses something that happened from a teacher perpetrating it at a school is super different than someone disclosing that they're experiencing intimate partner violence, in their home community and they're an adult. So you really do need to take a lot of thought. One of our core recommendations is really that even if you're a non-specialist organization, is that you sit with a GBV specialist, whether a consultancy basis or working with the subcluster there locally, to make sure that you adapt these materials and make them make sense in your context. Because unfortunately, on a global level, we can't, make guidance materials that work for every setting. So, we tried to have three very diverse settings of Iraq, South Sudan, and DRC to get as much learnings that could be universal as we could. But it absolutely does require sort of thought and adaptation at the country level to make the materials really relevant and useful for your context. And then I think Going forward, obviously, we know the humanitarian world is really changing. So we know that there's probably going to be less money for standalone GBV services, unfortunately. And one of the core recommendations, again, of this manual is you need to fund GBV specialist services. None of this is a replacement for those services. This is really meant to bridge that gap, just as Gabrielle showed, of getting people more support, of building up their self-esteem, their confidence, their resilience, and then with the hopeful eventual goal of having them access specialized support. But frankly, we know that that's going to likely be really hard, and those specialist services are going to be reducing over the next few years. So we really do see these materials as a great platform to better integrate some aspect of response into different sectors. And that's really, again, why we prioritize things like the sector briefs, why we really encourage, all different humanitarians from different sectors to really think like, how can we support survivors as part of our core mission? If we can't get them to formal services, what is possible? And this is really meant to be a toolkit that helps you think through those options. And as we said, everything is available on our website. It's all open source, from the nitty-gritty training materials up to the overall guidance document. So we really encourage you to explore, and always feel free to send us an email. The contact email is on the website if you have any questions. So yeah, I guess with that, Katie, I don't know if you have anything else final to say, or we can wrap up here.
We have a lovely comment from one of our team in DRC that just says the project's been a real learning experience for our staff and for the different departments, groups and organizations we've worked with. It's improved our relationship of trust and support with our participants. We've learned some very good lessons. So thank you to Mari-Mart for sharing that.
Wonderful. Thank you. And again, really thank you all for everyone who participated in this project in some way. We really do hope to keep it going in different ways. And I know Women for Women has also really excited about rolling this out globally. So this is not the end of putting survivors at the center, but it is a great moment for us all to come together and celebrate what we've done so far. So thank you all for your participation. And again, reach out if you need anything from us, and we will share the webinar link or the video link via email. So thank you.